Alright, as people get older, they are faced with many health problems, and one of these health problems that they can face is sundowner syndrome, also known as sundowning.
Slower.
This is due to confusion after sundown. Most people see sundowning in Alzheimer's patients or patients who suffer from dementia. However, people who suffer from dementia may not always show these symptoms, and with sundowner syndrome, not most people are aware of this disease. So that's why I'll inform you of the causes, the symptoms, and the treatments of this disease. The causes are still a medical mystery for sundowner syndrome. However, there aren't much studies done to help back up the causes that medical professionals believe. However, there is a wide variety of reasoning behind why this syndrome is here. One of them is related to changes to the brain's circadian pacemaker, which is a cluster of nerve cells that for the body to keep on a 24-hour clock. They believe that the change in this pacemaker has something to do with the onset of the symptoms. Also, they believe that accumulation of sensory stimulation from the day causes the resident to feel overwhelmed and cause them to become stressed. And also other professionals believe that it's just a hormonal imbalance that occurs at night, while others believe that's just due to fatigue and lack of activity. Some professionals just believe that anxiety causes them from not seeing well in the dark at night, but since medical professionals aren't well understood about the causes of them, they do believe that the increased risk for sundowner syndrome is due to pain, poor nutrition, overly medicated, infection, and noisy environments that causes them lack of sleep at night. Since the causes are not well understood, medical professionals they do understand what the symptoms are for this syndrome. There are symptoms listed on the Sundowner's Fact website that include rapid mood changes, fear, hiding things, crying, depression, and paranoia, and also anger and confusion. For example, if you go in there, they can start to become combative towards you, so they don't understand why you're there, what you're doing, and they don't even know what's going on, so they can lash out at you. And also they can be restlessness and wandering. This can be dangerous to them because as they develop sundowners, they start to lose their sense of direction, and once they get lost, they can get agitated because they aren't familiar with their surroundings. And also they can have hallucinations, which, for example, if you enter a resident's room who's having a hallucination, they could be seeing angels flying around the room one minute, and then the next they'll be accusing you of taking something out of their room. When these hallucinations occur, there's no reason to try to stop them because it simply won't work. They don't understand what they're doing, why they're doing it, or even know that they are doing it, and they won't even remember it in the morning. From the symptoms and the causes, there are a treatment for sundowner syndrome. However, they're not curable, but they also make this syndrome less severe. One of them is activity. They believe that fatigue has something to do with this syndrome, so if you make them exercise more and decrease their daily naps, that could help with the onset of symptoms. You can also do light therapy, where when the sun starts to go down at night, you can expose them to bright lights like the sun to decrease the onset of symptoms. You can also do medical advice, where you can have a doctor see them and review them for physical pain, such as infection, bladder problems. And then also you can do calm reassurance, where you can just remind them where they are, who they are, and what time it is, so they aren't as confused. And then for those who suffer from sundowner syndrome, the night is the hardest for them because they suffer from these emotional changes, from hallucinations to wandering. This syndrome can be very dangerous for elders because they don't understand what they are going through. And as research and technology starts to advance, I hope medical professionals can seek to find better treatment and understanding for this syndrome. Thank you.